Hi everybody, I'm Ian Harvey, massage therapist. This is my friend Heather.
Hello.
Today we're going to be talking about frozen shoulder syndrome. This is pretty darn common, especially in office working America, and actually in a lot of professions where you have to do a lot of fine motor movement. And it's something that kind of sneaks up on people. It seems to appear out of nowhere. There's often no obvious cause for it. Most cases of frozen shoulder are idiopathic. There's no clear etiology. If you're having someone with limited range of motion, maybe they can't do a lot of external rotation, or they can't put their hand behind their back, or they can't do a lot of abduction, then these are the symptoms that we're dealing with. Just realize that this is a syndrome that tends to take years to develop, so it's not something that you can really knock out in a single session. It might take 10 sessions or longer, and I'd like you to make your clients aware of that. What we're doing here is kind of retraining this nervous system, letting it know that it doesn't need to do this intense guarding that's preventing that normal range of motion. So Rome wasn't built in a day, and if you set those expectations, you might have greater compliance with any return visits and any stretching and strengthening you may give. Alright, let's get to it. So the first thing that I do with any frozen shoulder client is I will cradle their arm, and that looks like this. So I've got her wrist in the crook of my arm, and my hand comes over and makes contact with the shoulder. And now any movement I make with my torso is going to be translated into movement at this glenohumeral joint. And that's generally how I'll start these sessions, is some gentle rocking and some gentle work of this shoulder. So, from a myofascial perspective, that's going to mean we're working with these sheets of tissue rather than on any specific muscle in the shoulder. I'm creating some traction on the tissue, not necessarily of the humerus, and dragging it laterally. When I'm working with frozen shoulder, I want to warm up the pectoral region. So I'm just using the flats of my hand, and I'm doing this gentle rocking. And again, I'm thinking fascia. Transitioning into fingertips. I'd also like to work with this trapezius. I'll often put my left hand under the humerus and use that to create a little more movement in this shoulder girdle as I work on the trapezius. Now notice that I'm staying in a fairly narrow range of motion here. I'm not taking her far into internal or external rotation. I'll also want to work with the deltoid. Even though the deltoid muscle itself is likely not directly involved, the fascia that runs through it is definitely involved. If this deltoid is tight, that can translate into tightness up the line, into trapezius, into the rotator cuff, into the pecs. What we're doing is we're kind of dancing around the muscles that are likely acting up right now. So We're working with deltoid and pecs and trapezius and all of this surrounding fascia, and eventually we'll move into working with the rotator cuff muscles, which tend to be the ones that are acting up. Now, let's say I'm having difficulty making this kind of contact. Just this much movement and just having their arm in this position is already too much. Well, let me show you the main trick I use for frozen shoulder clients, and that's to compress the humerus into that glenoid fossa. So I'm going to apply pressure using the side of my body, and again, it's good, as always, it's good to talk with your client about this, so you let me know if I'm getting too far into your personal space, things like that. And by pressing this head of the humerus into the glenoid fossa, that can often turn off some of that spasm and some of that pain. And that will allow you to do a little bit more, to get a little bit more range of motion, to press a little bit more deeply. Oftentimes with frozen shoulder, if you have the person go through their range of motion and say, point to where you're having pain, they'll often point here, on this anterior shoulder. When I hear about pain here, I'm thinking about referred pain from back here, from the rotator cuff, and specifically from infraspinatus and subscapularis. But you can work on this anterior shoulder a bit. There are some good attachment sites there, and you can do some nice fascial work that doesn't require you to dig in on that area. So this is what my work looks like. Once I've done that warming up, I'll get my fingertips under the blade of the scapula. I'll do the same with these fingertips. And as I mobilize by rocking my body, I'll continue this gentle myofascial work on the scapula. If this is painful for them, I'll apply that pressure with my side. And what I'm doing is I'm dragging outward. I'm dragging laterally, then resetting my fingertips, and continuing on in that fashion. Most of the work is going to be applying that pressure, creating that compression of that glenohumeral joint, and working with that range of motion. But the myofascial release element is going to come from working with this scapula itself. So I'm going to work on infraspinatus using my fingertips. I'll work on supraspinatus using a single fingertip, and you'll need to be gentle with this because it'll often be a very tender region. And working with teres major and minor, and with subscap using my thumb here. So I'm going up into the axillary region. I've still got my fingertips here on this side, and I'm creating a sandwich of the scapula with my thumb and my fingers. And then I'm continuing that gentle work, that gentle rocking. Once I've done this general loosening of the area, I'll often stand up, and I will apply pressure with my leg, with my thigh, again, inward. If your client, if their arms aren't long enough to reach out this far on the table, have them scoot this way. Then you can apply that pressure inward. And again, that will often turn off some of that pain and spasm. The same thing with what I'm about to do, which is pressure downward and laterally in the pectoral region. So I'm inferior of the clavicle, and I'm coming out laterally. My pressure is directed this way. This way. My pressure is directed out laterally, and I'm going to continue doing those gentle rocking motions as I do this, seeing if I can get a little bit more range of motion. Again, I'm not shooting for the moon here. I'm not going to try to get them completely better in a single session. I think that's a good way of sending the person home with pain. I like to stay within the person's comfortable range of motion for the most part. I'll challenge that a bit each session, but I'll never try to get a 100% increase in that comfortable angle. Maybe a 10% increase would be nice. So, you know, if this was a typical client, which it is, you could come out like this and it would be a very nice stretch. But for frozen shoulder clients, again, I'm keeping this inward pressure with my thigh, with my knee, and I'm just taking them to where it's comfortable for them. I do a lot of communication with my frozen shoulder clients. I say, let me know when I've reached a point where it starts to become uncomfortable. If they don't say anything, I will remind them. I'll say, all right, now is this uncomfortable? And often they'll say yes, and then I'll apply a little bit of pressure inward and some pressure downward and say, okay, did that alleviate it? If it did, I'll continue on with that gentle rocking and with that gentle promotion of that external rotation. And for my next trick, so even though you likely can't abduct the shoulder like this, you can probably bring it into this flexion. So notice what I'm doing here. I'm planting my elbow. Let me get a better angle on this. I'm planting my elbow and I'm bringing this shoulder into flexion. So this arm is kind of in a swing where my hand is acting as that sling, and now I can work here on the side, and this is where a lot of that pain and tension is going to be, in the region of this rotator cuff. But that might be too much for some people, so I want to apply some pressure inward toward that glenoid fossa. How can I do that? Now this is going to be different for everyone, but as a guide this is easier. What I do is I rest their elbow against my chest, against my sternum, and then I get two hands free. I don't recommend removing this hand until the person is comfortable. But now, by leaning forward, I can apply that pressure down into that glenoid fossa, perhaps reducing some of that spasm. And anything that I do with my torso translates into movement at that glenohumeral joint. So now, I can apply that downward pressure at the pec, which can, again, reduce some of that spasm. And I can work laterally here. I'm going to be using a soft fist and pressing medially. But now I'm working on that lateral scapula. I'm working on the pec. I can move over here and work on the deltoid. And at all times I'm mobilizing just by rocking my body like this. Alright, and Heather, put your hand behind your head as if you're lounging. Now, if your client is able to get their arm up this far, it may take 10 sessions before this is possible for them. This is an excellent position, even if it takes a little bit of discomfort for them to get it up there. Usually they can relax like this. If you can get them into a relaxed position, then you can do a lot of tricks. You can do a lot of fun stuff For instance, you can continue that work on the pecs. You can continue that work on the lateral scapula. And Heather, let that arm fall. If your client can't let their arm fall like that, they may want a pillow under this elbow. And you can also work on their ribs. I might do a breast draping so that I can contact these ribs skin on skin and do some nice myofascial release. Or I might work through the sheet. It doesn't really matter. And by working with this fascia down here on the ribs in this thoracic region, if you can free this up, they'll feel that freedom northward. Something that I hear is if they've got this frozen shoulder going on, they'll have pain along here. They'll have rib pain, they'll have sternal pain. So see what you can do to release that stuff. Alright, leave me questions in the comments. Let me know your own experiences with frozen shoulder and some things that have worked for you. If you've got a technique that you think is especially awesome, make a video and I will link to it. I'll link to it right here. So, and I'll link to it in my description. So show me how you work with frozen shoulder, because I've still got a lot to learn. This is what's worked for me over the years and stuff that I've been developing. So leave me comments, subscribe, and I'll see you next time.